Yesterday, our 2-week positivity rate was 217%, or 141 cases in 2 weeks, which brings us back to it's the lowest it's been since mid to end November. So we're on a downward trend right now, even though it doesn't sort of feel like that sometimes in our offices, but we are. We are, as of yesterday, at 1,555 cases in Mason County. You will see that that differs from DOH's report. We have been working for 3 weeks trying to reconcile things with DOH. They're responsive, but things aren't changing on their report. So, because theirs as of now says 2,057 as of yesterday. We know that some of those are our WCC, and we've been working with them to get them to remove those. They did finally agree to make a separation in the WDRS system and put all of the WCC into its own line instead of filtering it in with all of our regular positives. Unfortunately, they still haven't separated the numbers in their data report, so we're still working on that with them. So hopefully we'll get to reconcile and be the same number at some point soon. We've also given 2,100 doses in Mason County between Mason General Hospital and Peninsula Community Health Services, and some pharmacies that are being able to give some. So that's where we're at right now. We're getting, I think we have a couple more thousand doses ready that are in the process of being distributed right now. We were given notice 1 week ago today that we were expected to do mass vaccination clinics, and they opened up, as you heard, the next series without any notice to us. I'm very proud of all of the people that helped pull everything together in literally 1 week's time to get mass vaccination clinics going and registrations going. And that includes our public health staff, the Department of our emergency management staff, school locations, and working with us in our, and getting signatures from the commission on getting our agreements with them so we could utilize those facilities that we've had for 15 years, agreements with them to utilize facilities in emergencies. Mason General Hospital and Peninsula Community Health Services. And the pharmacies. It's just been a record thing in 1 week's time. I think it's amazing. We have scheduled, the Peninsula Community Health Services has their first tomorrow mass clinic in the North Mason area. They've worked very hard, and Chris has worked very hard to help them in getting some logistic things done and supplies. We're looking forward to that. And then on Saturday will be our first one in the Shelton area. And registration was questionable. Every single county is having the same problem. We're hearing reports from everyone. All counties are just panicked because it's hard to get people registered when you have so little supply and so much demand. People get very angry very rapidly because they don't understand why I didn't get into the clinic. Our poor front office is bombarded by calls, as is Mason General and Peninsula. I saw that Kitsap, some places are shutting down their phones because the reality is we can't do it. It's too many people calling in, it's crashing systems. Ours worked really well. We put a notice out on our 599 vaccine message line, county line, on Friday, letting people know that on Monday morning, we specifically and purposely did not say the time. On Monday morning, we would be opening up registration for the Saturday clinic. And we were hoping to do 1,000. We ended up having to make it less than that because of logistics. We cannot move that many cars through in a 7 or 8 hour day. So we used a program that our Melissa, our epi person, community health person, thought of, and we put it up, and we had never used it before for anything like this. It's a survey type program, and it went up at 8:30 in the morning. IT put it up, and we also had a backup for phone, so people who didn't have computer access, they could call in, and we had a line for that was being answered, and we had 4 people rotating to, so that we could try to keep up as most as we could. In 10 minutes, when we checked the data on the program, we had already put in 500 people in 10 minutes registered. So one thing was positive. We were very excited it didn't crash the system because we didn't know what was going to happen. It worked perfectly. The phone was, is difficult, but it's what it is when people call in. We were very amazed after we looked at the data. We have 666 people actually registered, pre-registered for the Saturday clinic, and we've closed the clinic. And we had to close it in 30 minutes so that we weren't bombarded with more registrations than we had, than we could handle. Not necessarily than we have vaccine for, because you've got the other logistic problem of handling cars and people moving through. So most clinics we're finding are doing about 600 vaccines. We're hoping by moving to a different location for the next one, and that's trying to be decided right now between a couple of locations, to try to take in more cars so that we could actually handle more people. And we're trying to shoot up to 1,000, but we'll see how it goes. We're working towards that. And then, of course, once we go through the vaccine that's currently we have, we're ordering more. The hospital is ordering more, but then we will see what we get, because we're not going to know. So it's hard. We can't really set up a clinic until we know we're going to have vaccine, because that would be harder on people to tell them, sorry, we set you up, but we're not going to have vaccine. So we're excited. We'll see how it goes. We're thrilled that registration went as well as it did. Even though people were angry because, of course, you only got 600, almost 700 people in the registration, and people don't realize there's over 20,000 of them out there trying to get in. So we can only do what we can do. And we're finding that all of the other counties around us are in the exact same pickle. They're just running into the same problems. But we did learn today from the state. We were talking to the state about some issues with uploading the information into their system once people are vaccinated. And we were talking with them about that, and they said that they're hoping soon to have a program that will register for any kind of clinics, mass or anything. And I'm sure they need that if they're going to do huge mass clinics in 4 areas across the state. So they're planning that. And then it will also upload that information to the database for the state. So we in Mason General and Peninsula will not have to hand do that. So that's really exciting to hear that that's coming. And I'm sure it's coming since those clinics will be coming shortly. Let's see. We have had great volunteers coming in, and they'll continue to come in, and eventually we'll use less of our public health staff and probably more volunteers to do these clinics. Our goal is to try to do one at least once a week. We're working very closely with Mason General Hospital and Peninsula. Peninsula is already scheduling one a week in the North End. We're going to try to be scheduling 1 to 2 between us and Mason General Hospital, as long as we have vaccine. But that's the goal, is what we're trying to go for. So Commissioner Schutte, you had asked earlier about how many people are we going to be able to do. It's limited because of their mass. You can't push them all in a building. We can't do it the way we used to. You have to, so the car thing seems to be the best and keeps people safe, but then you need places that you can handle hundreds and hundreds of cars in a certain amount of time without blocking traffic.